The World Health Organization recommends the minimum amount of green space within a city is 9 square meters per person. We don't quite have that in Exeter, so it's really important that we use every green space we have, convert areas like these gardens in workplaces, so that Exeter remains a green and healthy city for us all to live in.
Around sustainability and in particular green space, there's so much related to wellbeing. We have a health and wellbeing initiative here, and some of that is focused on improving outside space and making sure that staff have adequate access to outside space. There is a proven link between green space and wellbeing, from the point that it can improve anxiety and depression, and it can also help with symptoms that people are suffering with in terms of long-term physical health conditions as well.
At the start of the pandemic, I was on some of the respiratory wards, especially overnight, and it was at a time when we didn't really know what the disease was. It was quite worrying, really, for myself possibly catching it and bringing it back to my family, but also actually just seeing patients deteriorate extremely rapidly and being basically unable to do anything other than call ITU and get them on a ventilator. And it really was like nothing else I'd ever really experienced, and a lot of my colleagues were the same. They really never experienced anything like that. When I was struggling, just sitting out in the garden watching bees and looking at the flowers and things like that, and just that time of reflection was really very helpful.
It was incredibly stressful, incredibly busy. We were having to readjust all the time. And over that time, the hospital developed gardens like this for us to have our breaks in a COVID secure setting, but also to give us that headspace and calm away from all the stresses of the day.
Even from the perspective of PPE, it can feel quite restrictive and it can be particularly long term. So to have the outside space and have that ability to almost physically break free from that environment has been a fantastic way to improve staff wellbeing.
Amy approached me and asked if staff at the hospital would be interested in becoming involved, and she gave me some of these packs. I managed the breast care unit, and so I put them in the waiting room there. I also introduced them at our team meetings across the surgery division and asked people if they wanted to collect packs, organise some walks around the site to collect flowers and engage more about the green spaces around the hospital.
Saw that it was pressing flowers and sending those in, and I thought this is really quite a nice way of documenting what's happened, and also documenting our natural world as it is currently. It's a really great idea.
With this commission, it's been an amazing source of legacy. This year has been a great year for reflection for an awful lot of people, and being able to think about things post-COVID and what that means to people is a great thing as well. So from that perspective, that legacy element has been the most exciting thing to be thinking about. And it is just that shared goal of understanding how we engage staff and what it means to have something that is through the lens of art and communication is a fantastic way to get people to think about things on a more of a deeper level.
The piece of work helps people to engage with the importance of the relationship between wildlife and our health.
From the flower that I sent in, although terrible things happen in the world, like COVID, like pandemics and things like that, the natural world is always there in the background, and actually connecting with that and working alongside it is a great way to get you through the difficult times.
I hope that people feel that there is something personal to them about it, just like with time capsules or anything else like that. It's about contributing something of yourself to something that's bigger than you. And as we sort of transition away into a recovery away from COVID, that's going to be an important part of how we interact with each other, is trying to understand that we are more than just ourselves and we're part of something bigger.